Chapter 20, The Future of Population Health at the Workplace, Trends, Technology, and the Role of Mind, Body, and Behavioral Sciences. The level of worker participation in wellness programs was insufficient to support desired population health objectives. Although financial incentives effectively increase participation, there has been limited effect on health risk reduction or sustained positive behavior change. And since annual increases in financial incentives have been necessary to keep the level of participation up, wellness programs are under increased scrutiny. Gradually, the environment and culture are being viewed as the next steps towards improving the health of workplace population. Population health at the workplace choices. Number one, you can continue to define population health in terms of biometric screenings, preventative services, and wellness programs, or we need to broaden the current strategy to include social, emotional, and other determinants of total health in the context of supportive workplace environment, culture, and climate. So here are some current trends that are affecting population health. Publicity supporting population health strategies. Every health-related issue in a magazine or newspaper has an article supporting healthy lifestyles or discussing population health programs in organizations or communities. Many articles also discuss the use of wellness programs. And then we've got health clinics. These have been growing at a rapid pace. These clinics remove barriers for employees who are seeking preventative services or treatments for relatively minor ailments. So in other words, this will keep them at work instead of home sick. We have environment and culture. Recognition of the importance of integrating health into the environment and culture. The culture of an organization has the potential to have a larger effect on the health of an employee population than the health promotion programming offered by that organization. If the company promotes healthy lifestyles like walking breaks or whatever instead of smoke breaks, then this will definitely help to benefit. Financial incentives promoting extrinsic motivation. So extrinsic motivation refers to behavior that is driven by external rewards such as money, fame, grades, and praise. Financial incentives alone may be unsustainable because you have to continually increase the incentive to maintain the level of participation over more than the first couple of years. High levels of extrinsic motivations can decrease intrinsic motivation. Games, competitions, and collaboration. Games for Health, which is a peer-reviewed journal, is dedicated to the development, use, and applications of game technology for improving physical and mental health and well-being. Things like rewards, leaderboards, competition between players, and collaboration are good examples. Everyone or most people have Fitbits, and I know in a Fitbit you can get a hold of friends and have competitions, daily competitions of who can get the most steps, or weekly competitions or things along those lines. Use of technology, apps, and smartphones. So Thoreau said, we become the tools of our tools, and the more complex our tools become, the more complex our lives become. So again, this is where Fitbit, heart rate monitors, biometric information, and things like that are monitoring us 24/7. And then the final one is the number of programs. The increase of interventions available are typically convenient tactics designed to change specific behaviors, often one behavior at a time. The current population health model at the workplace seems to meet the intuitive needs of the population in terms of health promotion, disease prevention, reduced healthcare costs, and decreased employee time away from work. Healthcare field has progressed from prevention to health promotion to wellness to well-being to population health. Within the next few years, population health at the workplace will continue to improve. So we're going to look at programs. The healthcare field still strives for continual improvement and growth. Programs remained focused on behavioral change, and improvements have occurred marginally. Not enough attention has been given to core motivational stimulation of individuals, social emotional decision-making, and social interactions at the workplace. Health risk assessments and appraisals. Health risk appraisals was developed in the late 1950s and 1960s. Traditional health risk appraisals focus on identifying health risks and behaviors as precursors to disease, high healthcare costs, and time away from work. An expanded health assessment is needed to take into account additional determinants of health, new research findings, expanded definition of health and performance, and new technological advancements. These assessments will help to explore social, connectiveness, and individual productivity, performance, and fulfillment. Incentives, penalties, and mandates. Financial incentives are there to help increase participation in wellness programs within a company. Unfortunately, it takes increasing these rewards each year to keep similar levels of participation. These high financial extrinsic motivators can result in lower intrinsic motivation. Some companies use penalties instead of rewards, so they will throw out higher deductibles for employees who don't participate in programs. And then some companies mandate that their employees meet their objectives to improve health to receive the most comprehensive benefits. Measurement for employer results. For employers, health of the individual and population is the stated goal of wellness programs, but lower health care and disability costs and reductions in the time away from work are also more frequent goals. Because of this, employees are wondering why they should participate in these programs to make the company more profitable. And then best practices to next practices. Next practices can be defined as disruptive innovations based on experiences with best practices, knowledge of the literature, intuition, a high level of vision, and clearly articulated outcomes. Now we'll discuss the long-term effects of health at the workplace. Advanced definition of health. So defining population health only in terms of the medical model takes a very limited view of health. When definition of population health is expanded to include the determinants of health outside of the medical model, the opportunities for success will broaden as well. Factors that affect health must be incorporated into successful population health initiatives. In order to move the population to thriving, healthy, high-performing, and sustainable outcomes requires earlier and more comprehensive interventions. Anxiety and stress as the epidemic of the 21st century. Depression and anxiety disorders will be second only to ischemic heart disease in the scope of disability experienced by sufferers by 2020. Stress-related disorders cost the U.S. about $300 billion per year in absenteeism, turnover, diminished performance, and medical, legal, and insurance costs. Current work demands are creating unprecedented levels of anxiety and stress among American working adults. Stress and anxiety as a result of 24/7 expectations. Some companies have actually barred their employees from using emails and other forms of communication in the evenings and in the weekends. Balancing shared values and shared results. Two major barriers to growing population health successfully are the general perceptions of conflicting values and unequal results. As companies continue a growing profit, the employer-employee gap and conflicting values may continue to grow. Resulting dissatisfaction will likely reduce participation in employer-sponsored programs. Right now, employer-sponsored health and wellness programs tend to focus on employer financial outcomes, reduced benefits cost, increased productivity, decreased absenteeism, workers' comp and disability, and an increased ROI. Until employees feel the most important outcome is their improved health and well-being, wellness programs will be met with skepticism. Strategic, systemic, and sustainable. Most population health strategies or programs are behavior change or tactical in orientation. In order to achieve goals in population health, visionaries must develop conceptual models to focus on the major objectives of the health of populations. The approach that organizations use to promote cultures of wellness use a framework modeled on 4 steps: strategic, systemic, and sustainable. Recognizing additional determinants of health. Population health interventions most commonly focused on decreasing the health risks that are demonstrated precursors of illness and directly associated with higher costs to employers in terms of healthcare utilization, absence, and disability claims. After decades of employer wellness programs, there is limited evidence of reliable long-term improvements in risks or better outcomes in terms of chronic health conditions. So population health must move from a singular focus on health risks and behaviors and costs toward a stronger focus on other important determinants or precursors of health and thriving, including attitudes and outlook, environment, and culture. Now we're going to discuss the future trends in population health. The science behind thriving. Positive psychology. The scientific study of positive human functioning and flourishing on multiple levels that include the biological, personal, relational, institutional, cultural, and global dimensions of life. It's very clear that there is much more to health than the absence of physical illness. People who embody these positive characteristics are more motivated to act and be productive, to have less anxiety, and less likely to become ill and bounce back more quickly from disease, thus costing the employers less in healthcare spending and lost performance. Influencing a positive outlook. With effort and attention, one can develop a stronger positive attitude and disposition. Simple practices like recalling 3 good things that happened during the day or expressing gratitude to someone can lead to increases in happiness and optimism. Manager optimism is positively related to employee optimism, engagement, and project performance. New insight about the mind-body connection. The human mind and body have a greater reciprocal effect than was once believed. The manner we carry ourselves can influence our emotions and attitudes. Advances in brain science. There are 2 basic rules governing neuroplastic changes in the brain. Rule number 1 is use it or lose it, competitive nature of brain plasticity. And then number 2 is neurons that fire together wire together. These 2 basic rules can help guide practical application toward achieving population health and well-being. And then forming good habits and then replacing the bad ones. Instead of working to break bad habits, we can work to replace them with better ones. The effect of context, environment, culture, and social support. Physical and social environments and cultures at home and work and in the community can influence mood, stress levels, creativity, performance, and ultimately health. Since most Americans spend more than half their waking hours at work, the workplace environment, climate, and culture can play a significant role in health and well-being. Culture of health is the creation of a working environment where employee health and safety is valued, supported, and promoted through workplace health programs, policies, benefits, and environmental supports. Effectively and purposely redirecting a culture requires a clear vision and a strategy set forth by senior leaders and embraced by all stakeholders in the company. Leaders have to live the vision, provide sufficient resources, and participate in aligning all stakeholders within the organization. This also requires persistence and patience from all involved. Culture change takes time. Cultivating intrinsic motivation. To achieve population health, collective behavior change is first. Even though the importance of intrinsic motivation over extrinsic motivation is generally acknowledged by behavior change professionals, many in the population field still rely on using external rewards or incentives to motivate individuals. This tactic has not generated the long-term improvement in health as hoped. Also, we experienced discomfort when we hold conflicting or dissimilar beliefs. Giving a person an extrinsic incentive or reward for performing a behavior that should be intrinsically motivating can serve to undermine the motivation. Paying the person for the behavior can diminish the intrinsic motivation to sustain the behavior long term. Decision making. Lifestyles are largely composed of the decisions made from moment to moment on a daily basis. The large amount of information available to help with decision making is very overwhelming and challenging to process fully. By understanding the social, cognitive, and emotional influences on decision making and behavior, it will be possible to develop more effective initiatives and approaches. Experiencing self and remembering self. Experiencing self, the definition is it lives in a continuous flow of movements and experiences, one after the other, is nearly silent in decision making, has little to say about the decision, finds happiness in things like building connections and spending time with friends. The remembering self is a storyteller. It's creating an almost immediate narrative about experiences. It has a far stronger voice in decision making, the one that actually makes the choices, and also it thrives on the more tangible things like accomplishments and goals. Population health must embrace an assorted array of concepts within and beyond the usual comfort zone and develop approaches that target both of the selves, the experiencing self and the remembering self. And then also the final one here is new methods, measures, and metrics. Population health must embrace a set of new measures and metrics for success in order to evolve it. It must also apply better methods for measuring the effect of initiatives. So in conclusion, significant population trends, the amount of popular press toward wellness and performance, significant advances in technology, the use of smartphones, new research in mind, body, and behavioral sciences, And then population health workplace trends, which would include recognize the environmental and cultural determinants of health, increase in health clinics in the workplace, as well as the adaptation of games, competition, and collaboration. So this concludes Chapter 20. If you have any questions, please let me know. Thank you.